Hey everybody, welcome to another episode of The Bitter Pill. So, today I wanted to just talk a little bit about what I see so often from people here in the United States, and even among people who I agree with on a whole lot politically, people on the political left, and it's just this lack of perspective, this very sort of provincial outlook on the pandemic that we're in the middle of. Where here in the United States, since it began a year and a half ago, about 640,000 Americans have died of COVID, which, you know, just to put that in perspective, that's approximately the number of people who die of heart disease in the United States in a year. So actually, COVID is third on the list for last year in terms of causing the most deaths. And it's really not at all a distant third. It's right up there with cancer and heart disease. And in addition, millions and millions of people have gotten so sick that they've had to go to the hospital. Millions of people have gotten long COVID, where they have very debilitating, severe long-term symptoms of COVID, lasting for months, or in some cases more than a year, because there are people who got COVID, more than a year ago, and are still, affected by it. And yet, you know, a lot of people seem to just sort of gotten used to the idea that there are all these people dying that weren't dying a year and a half ago, or getting very sick, who that wasn't happening to before the pandemic. It's like it doesn't faze people. And that includes people on the left, because look, we had you know mass demonstrations in the United States last summer over police violence, and well, we should have. It was appropriate to be outraged by this injustice, where approximately 1,000 people are murdered by police every year. A lot of them unarmed, and disproportionately black people and other uh, minority groups. That's an outrage. It's appropriate for people to be outraged, and yet there doesn't seem to be the same level of outrage against about this totally unnecessary cause of mass death and suffering that has put this in perspective, killed more people in a year and a half than all the wars that the United States has been involved in have killed, at least of Americans, over the last century, or a little over a century if you expand it to include World War One. Um, and this sort of came into focus for me. I mean, well, I thought about it for a while, but one incident that really prompted me to do this episode was the other day there was a uh, COVID outbreak of sorts in New Zealand. Um, and when I say of sorts, I mean there was one case that was detected in the Auckland area, Auckland being the largest city in New Zealand, and that prompted a lockdown in the entire country, lasting for 3 days, and in the Auckland metropolitan area for 7 days. Um, and you might think, wow, that's really extreme. Which was the reaction of quite a few Americans. But, you know, what's more extreme? Taking strict measures to keep a deadly disease under control so it doesn't spread, jumping on top of it as soon as possible, or just allowing it to spread willy-nilly, as the U.S. did, um, last March. Finally doing something about it, locking down, um, and then sorry, let's see if I can find this here. Right around mid-May or so of last year, the United States, U.S. government officials, governors, and President Trump were like, "Oh boy, we're down to 25,000 new cases every day. We've really conquered this virus. It's time to open everything up." So, they more or less did over the next couple of weeks, and so you can see what happened over the summer, and you know, uh, it's just it did not control the pandemic at all, resulting in a daily average of over 200,000 cases at the peak over last winter. And then finally, the vaccines rolled out, and so cases precipitously dropped, reaching a low of around 12,000 new cases a day in mid-June. And then the Delta variant became prevalent, and we are now back up to an average over the last 7 days of 137,677 new cases a year. Well, what about New Zealand? They've had 3,000, so only a population of 5 million, so slightly smaller than the state I live in, Indiana, in terms of population of the entire country, but still, only 3,000 cases, over the course of the entire pandemic. Let's see, what's Indiana? Confirmed cases total in Indiana, 800,000 or so versus 3,000. New Zealand's had 26 deaths the entire pandemic. My state, Indiana, had 25 just today and 29 yesterday. So just yesterday, in one day, Indiana, population of about 6.7 million, had more cases than New Zealand, population of about 5 million, had in a year and a half. Okay, so, how crazy does New Zealand, who's the crazy ones? Americans or New Zealanders? Let me just play for you the announcement by the Prime Minister Jacinda Ardern of the lockdown in New Zealand, and then we'll talk about some of the specific reactions that I encountered to this announcement.
Delta has been called a game changer, and it is. It means we need to again go hard and early to stop the spread. We have seen what can happen elsewhere if we fail to get on top of it. We only get one chance. That's why Cabinet has met this afternoon and made the decision that New Zealand will move to Alert Level 4 from 11:59 p.m. tonight. Level 4 will be for an initial period of 3 days, except for Auckland and the Coromandel Peninsula, who we anticipate will likely be at Level 4 for 7 days, due to them being most closely linked to our current case. I want to assure New Zealand that we have planned for this eventuality, and that we will now be putting in place that plan to contain and stamp out COVID-19 once again. Going hard and early has worked for us before. While we know that Delta is a more dangerous enemy to combat, the same actions that overcame the virus last year can be applied to beat it again.
Okay, so that was New Zealand Prime Minister Jacinda, and I think that's how you say her name, Ardern, talking about the lockdown that was announced for New Zealand, based on one case that was detected in Auckland. And you might say, wow, what an extreme reaction. But as of today, there were 22 cases in New Zealand, despite the lockdown. So the person who was infected, who had somehow slipped by the country's strict quarantine for international visitors with a COVID infection, which, in general, New Zealand has done such a good job of containing the pandemic that the only cases they have most of the time are a few cases of travelers who fly in to New Zealand. And they're quarantined and tested and so forth, and so it doesn't spread. So this was the first case they've had, outside of quarantine facilities for international travelers in 6 months. But they recognized, as contagious as Delta variant is, and they were able to figure out that this guy had traveled a number of different places. They realized that this was a potentially serious situation as far as spreading COVID, which they have largely kept under control. Throughout the pandemic, they did a very hard lockdown, initially last spring, opened back up in June, I believe, and they've had very few occasions of having to restrict things, since then. But have a look at some of the reactions that some people had to New Zealand's decision. So here's Max Blumenthal, who I love his reporting. The Grayzone, the outlet that he founded, Max and Aaron Mate and Ben Norton and the others who report for the Grayzone, do outstanding journalism, mostly on foreign policy issues. However, in this case, he really seems to lack perspective on what's going on here. So he says, media darling Jacinda Ardern orders New Zealanders to stay in their fear bubbles and not to talk to their neighbors because of one positive COVID test. Let me play what she said here. I think I'm going to have to... this browser really acts up with videos for some reason if I try to play videos in Twitter. So let me move over to Firefox here, and then it should play for you.
Do not congregate. Don't talk to your neighbor. Stay local and do not congregate. Don't talk to your neighbours. Please keep to your bubbles. It comes down again to those very simple principles. We know from overseas cases of the Delta variant that it can be spread by people simply walking past one another. So keep those movements outside to the bare minimum, wear a mask, and make sure you keep up that physical distancing. Stay local.
Okay, so to provide some context, which Max doesn't here, what she's referring to by bubbles is social bubbles, meaning people that like family members and close friends and so forth, that you have agreed that you're only going to come into close contact with those specific people, and you've all agreed to be cautious and wear a mask when you're out in public indoors and so forth and so on. And that's something that people did here in the United States. When things got, well, at least at first last year. They didn't so much later in the year, and that's why we had such a horrendous outbreak over the winter. But anyway, this shouldn't be a new concept to anybody, and the idea that maybe you ought to be afraid of a disease that could potentially kill you or make you seriously ill, and even if you're young and healthy and it's not very likely that you're going to die from it, you could spread it to somebody who's more vulnerable because it's extremely contagious. So, I mean, I don't understand why Max doesn't think COVID is something that it makes sense to be a bit afraid of. I just don't. I'm baffled. But she's not saying everybody should just live in fear or something and not talk to their neighbors at all. Just be cautious. Keep your 6 feet plus or whatever. Wear a mask if you're close to people, especially if you're indoors. That's all she's saying. So, anyway, let's take a look at another reaction from somebody on the left, Glenn Greenwald. He says, yesterday some Australian official decreed that citizens are not allowed to take their masks off outside to consume alcohol. I don't know what he's referring to there, but I'm not sure how much we want to make out of one government official saying something that maybe others were not. Today, the president of New Zealand ordered citizens not to talk to their neighbors. They seem demented, oblivious to the costs of sustained isolation, he says. Let's see. Let me see if I can... Okay, because I have my own tweet called up here. Let me look for Glenn's thread. So Glenn goes on to say, I've taken COVID very seriously. I isolated with my family from the start, wore masks, got vaccinated the first day I could, but the refusal of policymakers to weigh the, quote, substantial mental and physical harms from ongoing restrictions, even a post-vaccine world, is maddening. Last March, I interviewed 2 mental health specialists, Andrew Solomon and at Johan Hari 101, who warned that even a couple of months of isolation could be devastating in Western countries where mental health was already in crisis, falling mostly on the poor. Well, both Glenn and Max and many others who I saw talking about this, in particular New Zealand's lockdown, and to some extent Australia's as well, which Australia waited a little longer and they have a whole lot more cases than New Zealand did. But some people think even that's extreme, apparently. But what I said in response to Glenn was, it seems vastly more demented to pursue public policies that result in more than 600,000 people dying and millions of people getting long COVID or having to be hospitalized. And if you think New Zealanders have had sustained isolation, which he said there, you've no idea what the fuck you're talking about. Because, in fact, because they, as Jacinda Ardern put it, New Zealand goes hard early whenever they encounter cases of COVID, and they lock down and everybody wears masks, and they do extensive contact tracing and testing and so forth. Even though they actually currently have a very low vaccination rate, they've only vaccinated about 20% of their population. They've got almost no cases of COVID, and it's been that way for almost the entire pandemic. And so I showed this picture to Glenn of a concert in New Zealand attended by 50,000 people back this April. And let's see, I think oh. Yeah, and so there's the concert from April, and here's a scene from March of this year at the America's Cup sailboat races, where the defending champion New Zealand was racing their boat against Italy's boat, and you see the Italian flag there in the background of this giant crowd there in Auckland, New Zealand. These are Italians. They've come into the country to cheer on their country's yacht sailing for the America's Cup. And similarly, back in December, there were a whole bunch of international visitors from many more countries, including the United States, for the preliminary trials to choose the challenger, which turned out to be Italy, of the New Zealand boat. Anyway, obviously my point is, this is just normal life in New Zealand. They've been living normally for the vast majority of the past year and a half, because they take strict measures very early when they encounter cases, and then they get rid of it, more or less, or basically completely get rid of it for months at a time. And they just nobody's wearing a mask in any of these pictures. They don't need to, because they don't have any COVID in the whole country. And you might say, well, Jeff, New Zealand's an island nation, and it's so much easier for them to shut people out than countries that are have land borders or whatever. Well, as you can see there, they didn't shut people out. Thousands of Italians in this picture here, many, many other foreign visitors. They just, have to quarantine when they come in. And, get tested until they're given the all clear to go about their travels. So, Max and Glenn both really kind of got ratioed here. 900 replies to Max, most of them saying, look, this is a good thing. New Zealand, kept COVID under control, and their daily life, including for the most part, their economy, they've suffered some because obviously they don't have as much tourism as they did before COVID. But economically, they're doing better than the United States. They've hardly had anybody die from COVID, and like 26 people the entire pandemic, versus more than that on any given day in any sizable U.S. state. And so there are all these people saying, if you close down for one case, now you'll have lockdowns for the next 10 years. Insanity. Learn to live with COVID instead. It won't go away. Well, what's more insane? Locking down, relatively briefly. In New Zealand did have, a lockdown of, I think it was 3 months at the beginning of the pandemic last year, and they had a regional lockdown for a while later in the year, but in general, they just haven't had to do that. Um, it just hasn't happened. And many New Zealanders were reacting to Max and Glenn saying, "Hey, American, we support what our prime minister did. We like it here because we don't have COVID, and we have a normal life pretty much." So one of them, this woman from New Zealand said, "New Zealand's containment strategy is actually effective as hell. A lot of Americans are being petulant and saying it's ridiculous for us to lock down after one case was detected. But we did, and today we found 4 cases. Tomorrow, likely more." And goes on to say, "Every American genius standing on 600,000 corpses needs to recognize that containing the virus has let us live almost entirely normal lives for the last 2 years. Lockdowns haven't just prevented the spread of COVID, they've literally canceled the pandemic. Many Americans don't seem to get this and start barking about our individual liberties as though, one, the right not to die of a preventable disease is not paramount." She said is paramount, but I think she meant as if it isn't. It's like super important compared to temporary restrictions on where and how you can go places. 2, the containment strategy hasn't let us hang out in huge groups more often than they have anyway. As I just showed you. New Zealanders have been partying it up for much of the past year and a half, whereas only with the advent of vaccines have people been able to do that to an extent here. She goes on to say, "The ideology of individual freedom, showing yet again that it's completely internally contradictory. The people demanding their individual rights during a global catastrophe are the ones ending up with the fewest individual rights. Meanwhile, I've been going to work for the last year, which involves sitting in an enclosed space with 600 strangers. I've been able to go to a bar. I've been able to go dancing. As in China and the other sane countries, none of this has required mass death on the American scale." And she brings up China, which it's important to note. China, which has vast international borders with other countries, has even fewer cases per capita than New Zealand does, and fewer deaths. But in any case, New Zealand and China both had hundreds of times fewer cases and deaths per million people than the United States did. Update, we're at 21 COVID cases today, 48 hours after we first detected a case. This is exactly why we locked down, contact traced, and tested. Because if they hadn't done that, it probably would have been 1,000 cases by now. That's how fast the Delta variant moves. So, it'd be nice if Americans would look beyond our borders and you really take a close look at what's going on in the rest of the world. Because, there are a lot of countries, not just New Zealand and China, but quite a few other countries that have dealt with the pandemic massively better than the United States has. And, Americans could learn from people elsewhere. I just want to mention one other example of how there's this lack of perspective in our country, among many people, about just how horrific and massive the number of people who have died from COVID, who wouldn't, in the vast majority of cases, otherwise have died. I've seen it often brought up, well, COVID kills elderly people overwhelmingly. Hardly any children die from it. Hardly any young people die from it. It's not a big deal for you if you're young. First of all, what about those several hundred thousand elderly people who have died of COVID, who would not otherwise have died, at least not this year or last year? What about them? Didn't they deserve to live? In New Zealand they lived. In China they lived. In Vietnam mostly they lived. In Taiwan they lived. Um, Now, as for children, about 400, 400 or 500 of the 600,000 or so, 640,000 approximately was the latest figure I saw. Uh, only 400 of them have been children, under the age of, I'm not sure if it's 12 or 18 they're using, but anyway, very few people. But, uh, children aren't supposed to die. Very, very few children die, period. So if 400 of them, in the United States die within, a year and a half who would not otherwise have died, I mean, don't those 400 lives matter? That's 400 grieving families, where, parents have lost their kids. And that reminds me, another thing I pointed out to Glenn. I think it was to Glenn. Let me find that for you. Last March, I interviewed two mental health specialists who warned that even a couple months isolation could be devastating in Western countries where mental health was already in crisis. First of all, and this is shocking coming from Glenn Greenwald, who's usually very thorough in his journalism. He didn't even look into the details of, or just kind of forgot about the details of what New Zealand's doing. They're locking down Auckland and vicinity for a week, and the rest of the country for 3 days. We're not talking about months. And New Zealand hasn't had lockdowns lasting months in well over a year. So he doesn't know what the fuck he's talking about. As I showed you, life has been pretty normal in New Zealand, other than there at times people would need to wear masks indoors, or there have been brief regional lockdowns at times. But in general, lived pretty normally. So, what I said to Glenn was, imagine the mental health consequences when your family members fucking die, Glenn. Millions of Americans and Brazilians, the family members, and friends also, of a total of over 1 million dead people between the two countries have experienced exactly that. Like, how you compare the anguish resulting from, losing a loved one, maybe losing your parents, or losing your children, perhaps, or losing somebody you're close to, maybe more than one person that you're close to, as a lot of families have gone through, or being terrified that you or someone you love is going to die, and maybe they survive, but that's fucking traumatizing. How is that not a bigger deal than isolating for a couple of months, as people in pretty much every country did at the beginning of the pandemic? And I'm not minimizing the isolation that, for example, kids have felt from not being able to go to school in person in many places for a long time, and recently they went back, but they're doing so in conditions where the virus is still like there's been no less than 10,000 cases every single day, 10,000 new confirmed cases every single day throughout the pandemic. And you were sending kids off to school who can't be vaccinated if they're under 12. And, I didn't mention this a moment ago, but, yeah, kids have a very low likelihood of dying from COVID, although some of them have. But, they have a pretty high likelihood, roughly estimated about 5% of getting, long COVID, where they have serious impairing symptoms for months at a time or perhaps indefinitely. That happens to kids, and it's not rare. So, Glenn, Max, other people who were, lamenting the isolation of New Zealanders, kids in countries that have gotten the pandemic under control have been going to school in person for more than a year. They don't have to fucking do online schooling with their kids because they've controlled the pandemic. So this idea that, we have to, have our freedom and, not lock down, or open up as soon as we as possible, if we have had to lock down, it backfires in the long run. You either wind up having to shut things down again, or you put yourself or your children or whoever at risk. Is that really how we want to live? Or would we rather live, like this? Just free and happy and, keeping the pandemic under control. I know what sort of country I'd rather live in. How about you? All right, let me know what you think. Like and share and subscribe. And I will talk to you next time.